All right, hello, my name is Cassie Arnold. I'm one of the physician assistants here at the Joslin Diabetes Center. In this PowerPoint, we'll go over some helpful ways to prepare you as you plan for college. Transitioning from home to college life requires a huge step in independence. Hopefully you find this PowerPoint helpful as you prepare for your life-changing event. So, the Joslin transition process. Here at Joslin, we transition patients to the adult side of endocrinology sometime after high school. But as you may know, many of you will be quite independent prior to this. You may be gaining substantial independence as you set off for college well before you are done with high school. So, if you have not done so yet, consider talking to your provider about having a 30-minute education visit with one of our pediatric RNs to discuss your current diabetes management and ways to gain more independence. Choosing a college. Some things to think about are how far do you want to be from home? The farther away you are, the more independent you will probably need to be. As you visit colleges and speak with the students and the staff there, be sure to ask them, have they had other students with type 1 diabetes, and what are some helpful ways that they've helped accommodate these students? Talk with the college disabilities or auxiliary services. Type 1 diabetes is a chronic disorder, and you may require medical attention for a short period of time. This may lead to missed classes or tests. Discuss with your school what will be expected of you if that is needed. So the timeline. Connect with college roommates is one of the first things you'll probably want to get started right away. This might be a great time to let them know that you have type 1 diabetes or any type of diabetes. Make sure you discuss your current insulin regimen with your provider at one of your last visits with us. And it might be a good time to rediscuss pump therapy or CGM therapy. Make another nutrition visit to further solidify your carbohydrate counting skills. Start an open dialogue with your campus health office. What do they expect from you? About 2 months before going off to college, some other things you might want to do is plan for your supplies. Discuss with your parents or your guardians about who will be in charge of your supplies. Will you use a local pharmacy near your school, or will you just restock when you take trips back home? Who will be in charge of your refills or ordering refills? Where will you keep your insulin? At the school health office? What about sharps containers? Does the school have an area where you can get rid of your sharps? Or will you have to take them back home? Make sure you have a medical ID. Make sure you have easy access to your medical records, particularly your list of medications, past medical history, and family history. This can be stored on your phone for easy access. About a month before you head off, some more things to think about are preparing a sick day kit. Ask your provider for a list of things that might be necessary. Create a list of contacts. Including in this list might be your insurance company or a pump company, your continuous glucose monitoring company, the pharmacy, a mail order, and then of course Joslin Center and other providers that you may be needed to contact. Know how to get around near your college. Find the nearest pharmacy, or the nearest 24-hour pharmacy might be needed, the nearest emergency department for those emergencies, and then know about what way of transportation you're going to need to use to get to these places. Not a bad idea to pack up supplies, a surplus of supplies, maybe about 3 months worth. All right, life at college is going to be a big transition. So let's get prepared. Again, one of the first things you might be completely different than what you're used to now is having a roommate. It might be important to tell your roommate that you have diabetes for multiple reasons. Particularly if you have a low blood sugar. You might want to teach them signs and symptoms of a low blood sugar. Show them how to use glucagon and when glucagon might be needed. Have a stash of rapid-acting sugar that is off limits. Another new thing is cafeteria. Some do's and don'ts when it comes to eating in the cafeteria. Do look at the cafeteria's nutrition list for the amount of carbs in certain meals. If you're struggling with carbohydrate counting, make sure you make another visit with a nutritionist. Find the staples, foods that are readily available and you know how many carbs are in them. And continue to have regular 3 meals a day to avoid overeating. Some things to avoid is eating too much, going in for seconds and thirds. Eating high carb foods at nighttime might not be greatest for your health. Exercise. Routine exercise is good for everyone. Please do check your blood sugar prior to, during, and after aerobic exercise. Remember that a low blood sugar from activity can last for many hours after the activity. So checking a late night blood sugar is important. Find the time for exercise. And that the American Diabetes Association recommends 30 minutes of moderate to vigorous exercise, intense aerobic exercise for about 5 days a week, and then some sort of strength training for about two times a week. All right, transportation. You might be driving long distances back and forth to college. Always check your blood sugar before driving and getting behind the wheel. Your blood sugar target prior to driving should be 100. If you're below 70, which is a low, do follow the low protocol, meaning some rapid-acting sugar, about 15 grams, and then rechecking your blood sugar in 15 minutes. Follow this up with a 15-gram snack that has a little bit of protein. If you're not up to your target, make sure you do have a snack to bring you up to target, that 100. Stop to check your blood glucose every hour of driving. Also stop to check your glucose if any symptoms. Have a rapid-acting glucose source readily available in the car. And then get regular eye exams for early detection of diabetes-related vision problems that can affect your driving ability. Okay, alcohol. Let me first start off by saying the staff of the Joslin Diabetes Center and SUNY Upstate Medical Center do not endorse or encourage the consumption of alcohol by individuals under the legal drinking age of 21. But if you or someone you know has diabetes and will be partaking in alcohol, there are a few important things you need to know. First is that the symptoms of intoxication can be confused with a low blood sugar. You may feel sweaty, hungry, or have blurry vision, but it's hard to know if this is a low blood sugar or if this is the alcohol taking effect. It's therefore really important to check often while drinking in order to determine if your symptoms are related to a low blood sugar or are actually related to the effects of alcohol. What happens in your body when you drink alcohol? Your body considers the alcohol as a toxin, and the liver starts to work on getting rid of the alcohol. The liver is busy breaking down the alcohol and is unable to help raise your blood sugar like it normally does. Therefore, you're at much higher risk for a severe low blood sugar. This risk of that low blood sugar can continue for about 24 long periods of time, 24 hours after drinking. Top 10 ways to drink alcohol safely. Never drink on an empty stomach. Always eat prior to drinking. Eat a carbohydrate meal or snacks while drinking. Could be necessary. Don't drink within 2 hours of exercise. Drink in moderation. Check blood glucoses frequently. One of the most important things, do not take extra insulin to cover carbohydrates that are in the alcoholic beverages. Wear your medical ID and drink with friends who know that you have diabetes. Check blood glucose before going to bed. Have a carb snack if you're less than 130. You may need to set an alarm to wake you up in the morning or tell somebody that you need to have your blood sugar checked as soon as possible in the morning to make sure that you're not going too low. Hungover, throwing up, not eating, you still need insulin. If you have concerns or need further assistance, don't hesitate to call our care team. Never drink and drive. What are considered one drink? You can take a look at those options there. Just remember it takes about 2 hours for those drinks to break down. Okay, first scenario. You're out with friends and decide to have a drink of alcohol. You notice your vision is blurry and you become self-aware that you may be slurring your words. You don't remember when you last ate. What should you do? Check your blood glucose, eat something, and probably a good idea to stop drinking alcohol. All right, emotional health. Try to keep a healthy routine to avoid burnout. Find ways to relieve your stress and make time for it. If you're feeling overwhelmed, frustrated, or exhausted about having diabetes, be aware of that and take steps to avoid it. Know the signs of self-destructive behaviors. Have you stopped carrying your supplies? Stopped checking your blood sugar? Has your A1C recently increased? What to do? Know it is common. It is not it's not laziness or the fact that you don't care. It might just mean that you're getting burned out. Talk to your peers. Make sure you do talk to the disabilities office, or auxiliary services, another name for it, or the health office. And they may be able to help you more. Okay. Sick days while you're away at college. Develop a sick day kit. Like I have already mentioned, go ahead and ask your provider for a list of necessary things that you might need in this kit. Some sick day guidelines. Never stop insulin completely. Stay hydrated. If unable to eat, you should drink fluids with some carbohydrates to raise up the blood sugar. You're going to want to monitor your blood sugar frequently. Also going to want to monitor your ketones frequently. Call Joslin if ketones are small or larger. This is going to be 0.6 or more in the blood ketones or 15 or more in the urine ketones. There is such thing as a mini dose of glucagon that can help out when you're sick and unable to keep any food down. And this might be something you want to talk to your provider about at your next visit if you're interested. Know the symptoms and signs of diabetic ketoacidosis. Scenario. You have a big test today. You're up late studying for this test. You wake up and you immediately feel sick to your stomach. You feel hot, tired. You think to yourself, oh goodness, please don't let me be sick like my roommate was last week. What do you do next? Check your blood glucose and check for your ketones. If abnormal, take action. Remember to call Joslin Center if your ketones are small or larger. If you have signs and symptoms of diabetic ketoacidosis, such as vomiting, upset stomach, maybe you feel a little confused and really high blood sugars, make sure you take action. This cannot be left untreated. Call Joslin for more information or head to your nearest emergency room department. What about your test today? This is where your plan with the health services, or the other name, disabilities or auxiliary services, will come in handy. There'll be a prepared plan of what the next steps are about your test.